down to matches.
Okay. Well, welcome to Quantum Living Conversations. And I am Deirdre Catlin, and I'm here with Dr. Julie George today. And this is the third part of a three-part series on how we can better take care of our bodies and our health, and about cracking the code on how we can feel better living in our bodies in our day-to-day life. That how we feel in our body has such a big role in how we feel well and how we move through our day. I don't know about you, but I know for me, if I'm in pain or if I'm sick, then everything kind of goes out the window, and that becomes the focus. And so as we talk about kind of chronic illness or ways that we can crack through and feed our body better, Julie is a holistic doctor who specializes in the environment and how that affects your life. And I asked her to be on this podcast because I love the way she explains things. There's a wee bit of nerd in me that just likes the inner workings and understanding of how the body works. But it clearly, the passion that Julie has with helping people to feel better and breaking down what is going on so that they can live a better life, it comes through every time I talk to you. So I'll let you go ahead and introduce yourself.
Oh, thank you. So I'm Dr. Julie George. I'm a naturopathic physician in the state of Washington. I'm licensed in Washington. I do see patients all over the country doing more health coaching because we're only allowed to diagnose and do prescription style treatments in the state that we're licensed in. I've worked in Texas as well as Arizona in the past as well. And as far as for me, being a licensed naturopath was kind of my option when I was going through my undergrad. I didn't know what I wanted to do. And I thought I'm just going to go on the conventional route, and something energetically stopped me. And I just knew it wasn't the thing I should be doing. And I decided at that point to do a little bit more research. And I was reading through something, it's kind of like a Natural Awakening style magazine I picked up at a health food store, and there was naturopathic medicine. And I thought about that, and it was when I was 17, my mom took me to this witch doctor and to help me with my things. And I think she was a naturopath. I was like, maybe I should discover this a little bit more. And I found out it was a real medical school with real credentialing and all. And so I applied out in Arizona and went through the program. And while I was in the program, I had a lot of adversity with family members passing away and my brother being diagnosed with a brain tumor. And during that time, I happened to be working with Dr. Bill Ray, who was what I consider the grandfather of environmental medicine. And it just sparked something in me to put me on that course of environmental medicine is what I feel is the main reason why people are getting sick in our world now. I mean, we're just so contaminated with everything in our environment that it plays a huge impact on how we're feeling.
I love that you talked about the witch doctor, because it is. I mean, I come from that military background, and so it was okay, what is this stuff? It's working, but I don't understand. Can you talk more about that? Because I think we are demystifying that whole thing, right? You're talking, I don't know, about my view of witch doctor kind of is people taking long-standing practices that have worked and applying them to each individual, because we're unique as individuals.
Right.
How do you demystify that whole thing? And I don't believe in negating Western medicine. I mean, there's amazing things that have been going on, but you're coming at it from a different approach. Is that true?
There's definitely a time and a place. I guess, in the beginning, I thought it was a big joke, even my brother was like, oh, you're going to be a witch doctor. I mean, it was kind of one of those things. But what I explained, before penicillin, we had natural medicine and herbs. That's what was going on. This has been going on for thousands of years. There's messages all over about herbal medicine, everything that you need, let food be thy medicine, those quotes you hear.
Mm.
But I guess what I try to do when I'm meeting with people and talking to them and educating them is looking at the science. There's actual research studies basing research studies based off of these things now. You're seeing more and more vitamin D in research. You're seeing more and more curcumin. You're seeing these things all over the world now. It's not something that's isolated. So I try to focus more on the science. I am that science geek, and I want to make sure that what I am doing has been proven to work. However, there is a cross too when we're dealing with natural medicine that it's individualized. So you can't base a research study on someone whenever it's individualized too. So you have to have that little bit of gray area and flexibility that, one thing may work for someone just fine and it may not work for the other person. And even if there's a study there, it doesn't really matter. It's getting what's best for that individual. So a lot of science.
How do you, if it's individualized, do you break it down for the person? Is it trial and error? And so it's, does that create a barrier when working with patients, or how?
It can. So basically what we do in my practice, I have a really long intake. It's literally, if we were to print it out, 20 pages long. And that goes through an extensive amount of health history, exposures, things that people have been diagnosed with. And I get a pretty good map of what's going on. Then someone will come in and meet with me or do telehealth or telemedicine appointments. And we do a 2-hour intake where we're going back towards, where were you born? Where have you lived? Have you served in the military? What places were you stationed? Or did you grow up on a farm in agriculture? Did you live on a golf course? Have you remodeled your house? What kind of mattresses are you sleeping on? What kind of water? Do you have cell phone towers by you? We cover all of that to kind of get where we need to go next. Certain people need certain things. So when we figure out where we're at and what things may be the bothersome triggers for them, then we have advanced medical testing that's a little bit, it surpasses what you would get like at the conventional doctor on a regular blood test. We have more advanced testing that some insurances will cover, but a lot of times insurances don't cover these things because they're not standardized for Medicare. Medicare judges on if something gets covered or not. There's a politics in that. So for example, if someone's been exposed to, they worked at the airport, we might test them for benzenes and other exposure toxicants that they might have been exposed there. If someone is a hairdresser, we might test them for other chemicals. If someone has, recently put vinyl flooring in their house, we have testing panels that cover vinyl. If someone has silver fillings in their mouth or had them removed, we can test heavy metals. One thing I do like to do is genetic testing. That individualizes it even more. And I always call it's getting to the bullseye. A lot of people stand back 50 yards trying to hit the target, and they have the wrong tool to hit that target. We won't go into all those details, but they're not hitting it. They have a suitcase and they're just missing it all over with everything that's in that suitcase, where when we're looking at the genetic panels, we can get closer to that bullseye and get more individualized in treating the patient. And also that helps them stop wasting all that money on all the unnecessary things that they're buying at the health food stores and online and such, as far as supplements and nutrients. So that's one way to get more individualized, but it's really listening. I do a really good job of listening to the person, letting them talk and trying to just hear those key words of what's going on. And sometimes it's energetic, sometimes they need more of that energetic standpoint of changing their thought process. And then I send them to people like you, or, that's a huge component too. And my line of work is is the energetics. There's a huge correlation with people with PTSD and actually having mold exposure, Lyme disease, or chronic health conditions like fibromyalgia and such. So the more we can do things collectively with other practitioners, I feel like the more people have the ability to heal, and knowing that it's not an isolated event. It takes a village to get someone well.
And that brings up so many ideas right now. The first one that you hit upon was how much money we're wasting trying to do things based on what we read in the books on, or eating supplements that maybe that don't work for us, or and I think that's what I'm finding, you know, working with Connie, talking with you, that there's other things going on, and that the fix of maybe vitamin D, there's actually something else going on that's not allowing the absorption. And you're talking about getting at the root cause.
Right.
Ultimately, even though it may not be covered by all of 100% by insurance, ends up saving you money in the long run.
Oh, absolutely.
And then who knows what else with feeling better and less anxiety. When I spoke with the functional nutritionist, she noticed right away as she started eating foods proper for her body, her anxiety levels dropped. How do you relate? Is there any science behind, because you talked about the Lyme disease, PTSD, how do you relate all of that together? I do know that the military just did a study on the increase of the energy drinks. There's a correlation between higher consumption of energy drinks and increase in PTSD. Can you explain any of that, or how do you see that?
Well, there's a lot that goes on. I think it would take hours of talking to really get to the root of that. But I think, you know, especially with diet and lifestyle, a lot of our neurotransmitters it takes a healthy gut for our neurotransmitters to be working effectively. And so most people's guts are not actively, you know, there's dysbiosis, there's bacteria is out of control, or there's this term called leaky gut. There's a whole bunch of things. So the more we can eat healthy, that's specific for us, and the gut starts balancing out, then our neurotransmitters can start balancing out. We can get more of that, the balance of the peace and the calm and everything going on. But there's a whole bunch of different aspects that go on to that. So people that have been exposed to molds, mold can also interfere with gut health, but molds, you know, are linked to more of the mental health conditions. People with Lyme disease, parasites, any and all of these things that are in the gut or gut related can interfere with that. So when we're going at it, we have to look at the obvious of removing that obstacle for cure, but then we also have to give the right nutrients to heal the gut so it's producing, and then on the energetic standpoint, have them working with someone that can help with those improvements, especially in the limbic system.
Wow. One of the things that I remember talking to you about was the military. And we've talked about different places we've been stationed. You have the burn pits, you have the gases from, you know, just the fuels. And I know from talking with some of my maintenance folks in fuel cell, like they end up with some long-term problems. But one of the I mean, I would love if you could talk about that and then add on the difference between men and women.
So as far as military people, they typically have more exposures. Now, I'm not saying that they have more compared to everyone, but they have a lot more exposures just by, you know, their flame retardant suits that they wear, the chemicals that they're exposed to, going to multiple countries, all of the vaccines that they're given, just in general, if they're out on ships with jets, or, you know, in the Air Force, you know, they're just different things on base, the chemicals, they have a lot of exposures. And I always like to explain exposures in the fact that we're all born being exposed to chemicals. We have a toxic, and I like to kind of give the analogy of the body and a bucket. So we're born, and while we're in our mom's womb, there is toxins going through the cord blood. Right now, there's an estimate of about 250 plus chemicals in a healthy person every single day circulating, bathing that baby. Back when we were kids, we have no idea how many chemicals were there. When we come out into and our bucket starts filling up with toxins, depending on our age, there was lead-based paints, lead-based gasolines. There was all kinds of contaminants from home. If our parents smoked or didn't smoke, that comes into our bucket. Our bucket can only handle so much. And so when we go into the military or we have a dangerous job that, at a chemical factory or whatever it may be, we just keep adding and adding and adding and adding to that bucket. Usually that bucket springs a leak and we start having symptoms, but what do we do when we get a headache? The average person goes and takes Tylenol or Advil or some ibuprofen. What do you do when you get a stomach ache? You might take some Pepto-Bismol or something. We always are just trying to put out those fires, so to speak, versus actually paying attention. It's kind of like when that check engine light comes on in the car. A few people are going to take it to the mechanic, but other people are going to say, well, nothing's wrong with my car yet, and just kind of ignore it. So what happens a lot of times is whenever you have all of those chronic exposures, you start having those symptoms and they start getting more and more obvious, and people start going into the doctor, and then they're getting diagnosed with this and they're getting diagnosed with that. And it's not really hitting that root cause.
Right.
There is at some point when you keep adding and adding to that bucket where your body says no more, and it will spill over, that bucket will spill over, and then you're in an expression of a disease. For some people, it's something minor like, horrible migraines. For other people, it's major like cancers or ALS or Parkinson's, you name it. Major wise, a lot of times it's neuro related, Parkinson's, ALS and such, but it can be minor. Cancer is one of those big ones. But for women contain more fat. Toxins are stored more in fat than other places. Yes, you can have toxins in your organs, you can have toxins in your bones, especially like lead, but women contain more fat than men naturally, and so we store more of that. And so women also, and I'm not saying this as every single woman, but a lot of women have a harder time sweating. So we're not getting rid of those toxins through our largest amount tree, which is our skin. So we have a lot of uphill battles to trying to kick that. And so women tend to, and there's a hormone relationship too, but women tend to become more symptomatic with chemicals that I see in my private practice. However, I do see men that have a lot of problems too, but the women, especially military women, I see with more health problems than the men. And it could be that women just come into the doctor more too.
That's a good point, right? So you talked about women not sweating as much. Is that exercise related? Is that the deodorants we wear, or the antiperspirants, or okay?
Both. Women typically don't want to sweat. So whenever they don't want to sweat, it really does impair the body from being able to get rid of the toxins. Another bad thing is we do put antiperspirants on, and we put it right in this area. What is the biggest source of fat on our body is our boobs. They're right there. And so those chemicals that are in the antiperspirants, there's, talc in them, there's phthalates, there's parabens, there's all of that gets driven right into our breast tissue, which hangs out for a little bit of time. But we have to sweat. We have to sweat every single day. And women have a hard time doing that. A lot of times because they're blocking those abilities, or they're not working out hard enough, or, they're not going in the saunas. There's a lot of things. And I'm not saying every single woman, obviously, right, but it's just in general, I see that women have a harder time sweating.
And that's why one of your therapies is offering the sauna to help detox.
We have a medical grade far infrared sauna in the office, and I highly recommend sauna therapy to patients all the time. It's the number one treatment I feel like people could do and get better for a low cost. And so, but it does matter on what sauna you have. You want to make sure that it's not something that has a lot of chemicals in it, like vinyl or plastics or cheap Chinese parts, coming in from China that off-gas heavy metals and stuff. You need a good quality sauna. And another thing about sauna therapy is you want to make sure that it's slow and low heat, because a high heat sauna is just making you sweat to cool your body off. It stresses the body out. It causes more harm than a low heat, slow sauna.
Okay. Neat. You also talked about the mitochondrial level with women and absorbing chemicals. Could you explain a little bit of that?
So the mitochondria is an area of the body. It's the energy powerhouse of each cell. And so whenever we're exposed to certain chemicals and certain like pesticides and herbicides, they come into the body and it damages the mitochondria. And the mitochondria is very weak, and that produces a lower energy relationship. And it's really hard to start overcoming that area. So there's lots of nutrients that we can do to strengthen the mitochondria, get it back going, give people energy, as well as whenever we can get them back to exercising, that produces more mitochondria, keeps it going in a healthier relationship. But these chemicals that we're exposed to definitely go after the mitochondria.
And if I'm hearing you correctly, that's the energy creation source for us.
So there's a couple ways of creating energy, but that is the one that I feel like the chemicals go after.
So what are the symptoms for people that come in? I mean, there's the people who've been diagnosed with autoimmune disease, but before leading up, like what are some of the symptoms that we can start paying attention to start? Well, pay attention to our body, I guess.
Yeah, so symptoms are really interesting. It would be nice if people came in when they first started getting their first symptoms of, those putting those Band-Aids on, and they have just like a headache or fatigue or numbness and tingling. That would be nice. Typically what we see are people that have exhausted all of their medical means. They've been at the VA, they've gone through everyone, nothing's making them better. They've gone through every hospital system. They're just at their wits' end and they are not getting better. And this is their last resort, and make me better. It works a lot better if we're going to start with prevention first before we have any symptoms, so we can see what's going on in the system, see the genetic pathways, which look like this. So we can start with our genetics and really go in that cycle for prevention. That's where I feel like you get the biggest bang, but prevention doesn't sell. Most people are waiting until they have so many symptoms that's so far gone. But I would say the average symptom complaints, chief complaints, people come in: lack of energy, weird muscle joint aches, numbness, tingling, exhaustion, and brain fog. Brain fog is a big one. It's a gray area. There's really not a diagnosis code, so to speak, for brain fog, but it's usually, that's what people say. It's either hard like to think through the fog, or they're constantly forgetting important dates, or they're forgetting where they put their keys, or just like these basic things that we take for granted. They can't process that every single day. So those are kind of the main ones, but I mean, it goes from all over the boat, from white tongues to, weird stuff with GI complaints. I mean, I've heard every complaint you could possibly imagine.
So I imagine part of the barrier, part of the thing in the beginning is they're not really screaming symptoms, and we dismiss them, or I don't want to be a hypochondriac, or
right.
Or like you're talking about, regular medicine isn't really pointing to anything yet.
Right.
And I know I've heard from a lot of people, I just feel off and I don't know what it is.
Exactly. That's where the challenge comes in. It's educating. This definitely prevention hasn't been something that is emphasized in our country. Our country is a sick You go to the doctor when you're sick. What we do when you go into the doctor is you get some antibiotics or, some immune suppressants, whatever it may be for whatever condition, and have a nice day. On this side of the fence, it's really trying to strengthen the immune system so that you're able to fight. It's giving you the right nutrients to be able to do all of the biochemical steps within the body. It's protecting the gut so that your immune system is doing, a good job. It's protecting those the gut dysbiosis, again, making sure that we're able to have bowel movements every single day. That's probably a big one too, is constipation. I would say that's probably number one issue. But all of those things are really important on the prevention side. But like I said, most people come in once they have, 10, 15 different symptoms, and then it's peeling the layers of the onion back. It's like we have to find some starting point. We have to start at that point and then go backwards. And it takes a lot more time to do it that way versus an instant, here's the magic pill, have a nice day. It takes a little bit of a commitment.
Two questions that come to mind is, one, I can kind of understand, or at least picture, why DNA mapping, I guess is probably the best way to say it, is important. From your standpoint, what does that provide? And my other question is, why don't we just do that anyway? Well, I know it's new, it's relatively new, but why don't we start that in the regular world, regular medicine?
The genetic. So some doctors are getting to where they're testing, but it's all for drug relationship on the conventional side. They're testing to know what drugs people can handle and which ones they can't. Okay. I personally feel like everyone should be tested as early as they can because it just prevents so many different health complaints going forward. It's actually genetic testing, and it's the study of epigenetics, where we can turn on or turn off the light switch by our lifestyle and our nutrition and what we're doing. So it's rather fascinating. Just because someone looks at their genetics does not mean that they're going to have a disease, but it does show that, hey, we need to pay a little bit more attention to these things to prevent disease courses or to help. When people come into me once they already have a diagnosis or they have these symptoms, I'm really looking at that methylation cycle to determine what nutrients they need to be able to detoxify and what nutrients they need to be able to spin those cycles so that everything is functioning as best as they can, so that we're not wasting their money. That's the number one thing I don't want to do, is waste someone's money. I want them to have exactly what they need for their body versus, here's, take all of this, it might work.
Can you speak more to the epigenetic side? Because it's in the news science, and I touch on it a little bit with my patients. But from a doctor standpoint, what can you tell me?
Yeah, so epigenetics, like I was saying, is it's turning on and turning off what could and might not be there. So just because, say for example, your family has heart disease, just because, I'm not generalizing this to you, but like just say, someone named Joe comes into the office and every single person in his family has had a heart attack. And he's like, I know I'm going to have a heart attack when I'm 45. To me, I'm like, that's not the case. It could be a genetic profile. Let's look at your genetics. Let's see if you have high homocysteine. Let's see these things. Let's see the cholesterol markers. Let's look at the whole picture. But lifestyle wise, we don't have to turn that on. As long as we're giving you the right nutrients, we're doing the right lifestyle things, we're taking out the toxins, you don't have to be that statistic that your family has in the gene course.
That's super cool, because that's in talking with you over the years that we've had different conversations. That's one of the points that I really love kind of pointing out to people, is your body, even though we've done all of these things that are maybe not beneficial, our body still is pounding away, like kicking butt.
So, your body is so amazing for what it can do and what it's a miracle. Like in general, it's a miracle that all of these things do what it needs to do without you even thinking about it. It's amazing.
What are some of the things? So I kind of want to change a little bit of subject, because I know, and you can put the brakes on anytime how controversial you want to get. But I do know, listening to various naturopaths for the past 5 or 6 years, there have been a lot of things going on that make it really difficult for you guys to do your jobs. True?
Yeah,
Is that an overstatement, or?
that is absolutely true. It's super challenging. As far as licensed states go, I'm not sure how many states are actually licensed in the United States, but it is a process to get a state licensed. The other side of the fence is always trying to put out false claims about our education and such. And so there's constantly these battles that are happening behind the scenes on that. The pharmaceutical industry does not want to see us go forward. That's a huge concern. Right now, with the current, how do we want to say this, COVID, we have been pretty much told not to say a word about it, because we will have no protection if we're advertising, marketing, treating. And we have therapies that do work and can help people in that situation, but we are not supported or backed. There's a lot of unlicensed states that takes a lot of money to get them licensed. There are unlicensed naturopaths that did not go to medical school. They're considered more traditional naturopaths. And there's a whole side of them not wanting us to be licensed, because then that puts regulation on them, which they don't have any proper education as far as, medical school. They have,
Right.
I don't know what they do, something online. So there's a lot of parameters, but I would say government wise, it's a hard battle, and it's really challenging. The insurance companies I have been told personally, they don't like us because we refuse to follow orders of their system. And I'm okay with that, because I don't take insurance. I like, if I need to go from A to Z with a patient, I want to go from A to Z. I don't want to be told I have to go all the way down the alphabet before I get to Z. They might be dead by then. So there's just a lot of political stuff that goes on. It's challenging. Unfortunately, with COVID happening, a lot of doctors have had to shut down their practices. A lot of doctors have had a lot of stuff happen to them. So you're kind of in a gray area. You're in a gray area. It feels like you're all alone out here.
So then I ask, what keeps you going?
Honestly, it's the people that I help. My favorite patient that made the biggest impact on my life was a lady that served in the military. And when she came into me, and I want to cry just for talking about it, but when she came into me, she could barely walk. And she literally drove for 7 hours to come and see me. She was led to come and see me. When she got to the town, she didn't even know where she was going, and someone told her in a natural grocer store to come and see me. And she came in. She could barely walk coming in. She had been exposed to numerous things, the burn pits, you name it. And she had been seen by every doctor that she possibly could see. She was living basically, as minimalist as she could. And in a short period of time, we gave her hope, and she was able to climb a mountain within a month in moccasins without cushion in the shoes. Wow. And we became dear friends, and I love her to death. And it is just people like that give me power to keep going. Because there's a lot of days you don't want to do it anymore. There's a lot of days you're just tired of, the insurance denying this medication for this person that needs it, or them not wanting to pay and the patient getting upset, or whatever it may be. But that's when you make those changes that gave someone life and hope and dreams and a better quality of life. That's what makes me go. And another thing that pushes forward is I lost my brother to a brain tumor after he bought America's #1 mattress, which is known to have neurotoxins in. And if I can educate people in my office to prevent them or their families or their kids from having cancer for doing simple things, that is enough for me to say I lived a purpose here on earth.
That's pretty cool. Well, thanks for sharing. Sorry
Yeah.
for your loss. One of the questions I was thinking about with the lady you were talking about, is there a time frame where these things present? Or because I imagine that we don't even equate 20 years down the road that it was our experience in Iraq or Afghanistan or wherever.
So a lot of the women that serve tell me that they noticed something changed the moment they got like a big amount of vaccines or whatever to go overseas. So I hear that quite frequently. A lot of them come back and tell me that, oh, I'm starting to lose feeling in my fingertips or my toes, or the fatigue is just unbearable. Some of it is gradual changes, and then it just keeps getting worse and worse, and they get all of these horrible diagnoses. And so the ones that are more aware of their body can usually pinpoint a time of when it happened. And, that whole I was about to be deployed is usually whenever it comes back as like that pinpoint area. But a lot of them, it was as after a year or two afterwards, nothing's ever gone back to normal.
Especially because there's so many factors that can play into that we can get distracted by it.
And a lot of the younger women have infertility issues, or, there's a lot of that factor going on too. So, and then once we start unraveling, there's a lot of chemical exposures.
Interesting. Do you notice a difference between how younger people absorb the chemicals or older? Like, have you noticed any connection to like Guard Reserve, which is older demographic usually, or the younger kids, or
so
you just haven't had time to study it?
As far as people coming in, it's usually the older population, or I shouldn't say old because, it's not people at 80 years old, but it's usually middle life and older is when people start noticing that something is wrong. And the longer that toxic bucket has to fill, the more symptoms that are going to come up. Younger people are more resilient. However, we are starting to see more problems. Obviously, we have a lot of kids with autism. We have a lot of cognitive decline. We have a lot of things that we're starting to deal with now in the younger populations. And then I would say for that 20-year-old range, it is the infertility. That seems to be a big issue with women, that, and I guess men too, but we didn't really have that as a key focus, 20 years ago.
So with all this, I can sense that there's a huge pressure from the outside, right, to keep slugging along and doing what you're doing. And I think for a lot of folks who are kind of doing that pioneering work right now, there does need to be that internal drive that's bigger than self. What makes you hopeful? Or is there something that makes you hopeful about this whole experience?
I mean, that is a really good question. As far as being hopeful that changes happen, hopeful that medicine gets better, I can't say that I have hope in that, honestly. Okay. My hope is in myself and the energetics of myself. So if I can meditate in the morning and stay positive and connect to my source energy and really get into that energetic standpoint, then I feel hopeful. But hope that government regulations are going to change and that, no. I feel like it's more an inner being work with source.
I love that, because that seems incredibly applicable to the times right now in 2020. Yeah, because it is that inner source, right? Like,
Mhm.
and
Yeah,
then, and I imagine, because I've seen it work with me, like as we interact with you, then it's like, wow, cool. Here's some things that I can do to improve my health. Um,
right.
and I think part of it could be education, but what are some things that we can do as people? And I mean, I don't know that it's going to the legislatures, but being aware, I guess.
Yeah, I think it's time to wake up, honestly. I really think it's time for every individual to wake up and not really pay attention to what is happening in the news, but actually wake up and go and do your own research and find out what's true. True to you, because there is truth on both sides of each story, right? So it has to be your own inner truth. But there's so much going on. There's so much information back there that I don't really want to talk about it. You think I'm like a conspiracy nut, but there are so many resources and there's so much cool information out there, but it's scary. It honestly is really scary to know what's happening and going on. So the more you can do a little bit of research and find out and wake up to what's going on, and knowing that what you're fed in mainstream media, and even some of these books that are coming out, isn't exactly what is maybe truthful for you. And so that's a big thing.
What are there some resources that you trust, or websites, or on the medical side? We'll keep it safe for you. Like if I were looking for a trustworthy resource to try to figure out my symptoms, or gather more information, are there sources out there like that, or are you just
I,
filtering
I
through doctors and the searches to see which feels right?
So I think that there are a lot of doctors that are being hushed and not being able to speak the truth and not being able to put things out there because we get shut down. So there are some doctors that can go out and speak out and put things out there. I think Dr. Mercola does a really good job of educating on his website and his blogs. And then Dr. I would say Dr. Mercola is probably the one doctor that puts a lot out there. There are other smaller doctors that put, information and bits out there. It's just deciphering through and finding it.
Mm-hmm.
There's a lot of stuff documentary wise. I feel like a lot of documentaries that aren't sponsored by big corporations have some truth to it. And then once you find out and you watch these and you get a little bit more interested in what you might believe in, then you can start finding and sourcing. But right now, censorship is big. We're being censored on social media. We're being censored on Google searches. We're being censored all over the place. So it takes a little bit more push to get out there to find those truths. And I don't know if that's going to get better.
Interesting. It brings up something that I've been kind of asking, at least the last 2 weeks, of myself, and maybe I've always done this, but it's like, who benefits, right? Regardless of what I'm reading, it almost sounds like you're saying kind of follow the sponsorship or follow the money. One of the things that I've been reading or seeing is just asking myself as I'm reading, who's benefiting from this? Like, what are the second, third order benefits of something versus just taking things at face value?
Right. Absolutely. Absolutely.
What do you use for your filter?
Money, politics, who could be paying for it, who's doing the research, what companies, if they're using independent labs or what's going on. But I'm trusting the people that aren't affiliated with these major corporations and political dollars.
And that brings up a really good point. I know statistic wise, the only thing I ever learned from my stats class is I can basically manipulate the stats to come up with any and support any of my hypotheses, which
Absolutely. Which is
which
happening every day right now.
Which completely frustrated my whole experience with stats, right? Like, what?
Yep.
And so I think the thing that I learned from that is really trying to tap into or understanding their integrity, and which
Exactly.
I don't know you can really find in a report, or
Yeah, that's the
trusting that
hardest.
inner gut feeling, right?
it has to come from a source, that inner gut feeling, getting aligned, really meditating or focusing on how you feel about it, because at the end of the day, there's so much controversy on each side. I mean, the vaccine thing, the war against the vaccine, is it good? Is it not good? Should you do it? Should you not do it? I mean, we're being divided so much between everything you see on the media and such, as far as you're either a good person because you did it or you're a bad person because you didn't do it, and that's not the fact. It's really coming up with how you feel, and then going in and looking at all those ingredients and looking at how they're doing it, and does this align with your morals and ethics, or I mean, it's really getting to the source of every single person needs to decipher what they're doing versus trusting in that doctor, trusting in that, nurse practitioner, whoever you go to on making that final call for your body. That's not the way it should roll.
Well, and it sounds too like you're kind of hitting towards the empowering, personal empowerment side of getting second opinion, right? Like I have a friend who had an issue, and they saw that first doctor, and it's like, well, I'm going to get a second or third opinion. And then the ability or the internal strength to say, you know what, I don't think we're a match. Let me find someone who is.
Right.
How, I think, because I was part of this too, we kind of give our power away to doctors because they're, we were brought up to that they were the experts, right? And I think there's a tremendous amount of respect for all the study and everything that it goes through. Are there signs or things that should kind of set the bells off for people? Or
I think the big thing about conventional medicine in today's world now, our old school conventional doctors could think for themselves. Our newer generations of conventional doctors, and it doesn't just go into doctors, it's the whole medical system in general. They're being governed by the pharmaceutical industry. They're being governed by the insurance agencies. So some doctors may believe what you believe, but they can't do what they're doing because they accept insurance. They have to, go through these parameters. And so if you are in the conventional world, it's finding someone you resonate with. If you're on the outside of the conventional world in the naturopathic or functional medicine, it's again, finding someone that you resonate with. You have to believe in your treatment. You have to believe in what you're doing for anything to work. It's not going to work if you don't believe in it. If you go into the doctor because you have high blood pressure, but yet you don't believe in high blood pressure pills, and they give you high blood pressure pills, those pills aren't going to work for you. So it's trusting the gut and trusting in your own ability, but also it's getting to the bottom of really figuring out what's right, and looking at those signs, especially when it comes to things that are supposed to be vaccine related. Or I do a lot with Lyme disease is something in the government they don't really recognize past acute Lyme, and it's a hard struggle. It's a really hard struggle for these people. So it's getting to trust, but also not over researching, because I think a lot of times when people start doing and picking and choosing from all different things, they really don't have belief in any one thing, and they're not going to achieve those results because they don't have enough belief in one or two approaches.
Well, and as you're talking, and I'd love your opinion on this, is you were talking about people waking up, and I remember picking up a Coke or something going, when did we agree to corn syrup, right? Like, and then I just started looking at all these other things of like, it sounds like what you were saying with the doctors, like there was this shift from the doctors having a lot more authority, or they were not groomed, they were educated in a different way, and somewhere there was a shift that maybe we didn't realize as a general public that happened, right? Whether it's GMOs in food, or how different treats are made, or like there was this shift that's like, wait a minute, what year did that happen?
Exactly. And who was behind that and why did it happen without any of us even knowing? Like,
Right?
I mean,
When
I
did I agree to eat this?
exactly, exactly. And that's a part of that waking up and being more consciously aware of what's going on and occurring. And, sometimes if you haven't been in that standpoint, people might think of you as a total crazy person while you're going through it in the first couple of days. But it's really trying to learn as much as you can, because at the end of the day, it's your dollars that are voting for everything that you do. And it's your dollars that are voting for your health. So if you want to be healthy, you're going to have to spend the right amount of money on the right foods, the right nutrition, the right waters. It's really getting down to you are 100% in control of what is happening around you,
Mm.
not of what is in the chemical industry. It's what is coming into your house, shall I say.
Right. No, well, you're saying you have the choice of what you're bringing into your
Mhm.
life. Um, and that's a really great point, is when we first start realizing what we're doing to ourselves, we want to share it with everybody, right? That's where that kind of crazy
Mhm.
thing starts
Yeah.
happening. Um, what have you learned in that? Because it comes from a genuine good place of like, oh my goodness, like I don't want people to be hurting either. But
I
where
have
is that
noticed
balance? Or go ahead.
I have noticed that people do not perceive it well, um, unless they're in the same paradigm as you. While you're shifting out of your old paradigm into your new paradigm, it's a really hard, lonely experience till you find your tribe. Um, because usually people like family members and close friends, they don't want to see you change. They don't want to see that. So it's a shock to them when, oh yeah, that old cookie you bought is no longer a good cookie, or the fact that we need to get rid of our mattress and get something that's healthier, whatever it may be. They don't like their world to change, and they have to be ready to change. So that paradigm shift is really hard on people closest to you. And I can talk all day and tell people what kind of everything they need to buy or have or do. But it's usually the people that are in the same paradigm or are in that process of switching that are more open and receptive. And unfortunately, they're not usually the people that are closest to me and my tribe.
Hmm. Well, and that brings up some interesting points, because I'm thinking back to my dad, where, you know, uh, increasing dementia, lots of
Hmm.
medication, which then is like,
Hmm.
wait, are these contradictory? Like,
Right.
I might not be the right word, but like, he's taking this because this does this, but this does that, right?
Yeah.
Like, it's like, why are we adding
The
more,
juggling.
more medication on it? Maybe what if we eliminated this, right? That would take away
Yep.
four things. And so,
Hmm.
but just talking to him about, hey, what if you drink more water? What if you drink more of these things?
Hmm.
It is really hard.
It's a
Maybe the older
challenge.
people get, or is it habit? Is it like,
I, it's a habit. I mean, I think it's a family and a lifestyle. I think that's why we see more lifestyle diseases in certain families, because people are brought up and raised the same way. I mean, you buy the
mm,
same laundry soap as your mom bought, unless you went and made those changes. You're going and eating at the same restaurants, you're shopping the same way. It's definitely something that I think is learned. As far as like breaking those habits, I think the younger we are, where we can make those shifts,
mhm,
it will change.
mm,
But I see the thing that makes the biggest shift and change is when you watch a loved one die, or you see, sorry, this just popped up. Hold on. Um, you see a loved one die, or you see someone that's really close to you go through something, or you're going through hell in your own health. And
mm,
that's where we see those biggest changes. I mean, like I said in the beginning, people don't usually spend money on prevention. They don't see that they may need it in 10 years. It's kind of like saving up for your future. Not very many people do it until they're like, oh my gosh, I have to retire one day. I need to
right.
start saving. It's not the American way, shall we say, like there's so many things that we need to be doing, but it definitely is a lot easier when you start younger.
Well, and that's a great point that you bring up, because I was just having a conversation yesterday with someone who is like, if I can tell my story and someone 10 years earlier
Mm-hmm.
gets this
Mm-hmm.
and makes that shift, then I'm that's why I'm doing it. And yeah, I'm sitting here and I don't feel old and I don't look old, but I know I'm learning to eat for my body because I want to be doing all these things when I'm 90 or 100 or however I'm going to be.
Exactly.
And so I'm like, man, if I could have just gotten through that 20-year-old invincible, like, hey, you know what?
We all did it.
20 years, this is not going to work for you. So, you know.
Right. Well, we're all guilty of that, and we can change. Our body is resilient. We can change at any point. The cells will start behaving better, and doing things. But definitely that's the whole point is whenever, some people think living a long life is 60 years old. Some people think it's 70. Some people think it's 90, and the definition of what people think of health has really shocked me. A lot of people think health is going to the hospital or taking the medications versus not having to do that. So I think there's a way each person internalizes that. But for me, my goal is I don't want to be on medications when I'm older. I don't want to be a burden to my family when I'm older. I want to be able to make my choices and my decisions and live each day to the fullest I can. And so I try really hard to live the healthiest life I can. Now, does that mean something bad is not going to happen to me? Absolutely not. There's a lot of factors, but I try my hardest to live as healthy as I can.
Well, and those are the things that we can control, right? We're trying to control so many things we have zero control over.
Yeah.
But these are some of the things, the choices that we make are
exactly,
especially when it comes to our health. There was one point that I kind of saw a thread for of as we're coming into how to make ourselves feel better and health, and we want to share it with folks, sometimes the only thing we can do is be that example, right? Of
exactly.
Wow, rather than pound it into their heads, it's like, you look better, you seem happier, what are you doing, right? Like that's the invitation, I think. And
exactly.
I mean, there's so many teachings about being the example.
Yeah. When you're the walking example and you're living it and breathing it, and people start noticing how well you're doing, they'll ask questions. And that is the perfect segue in to start, telling them. But what I've noticed is unless someone's asked, I don't tell. And when I got out of school at first, I would see someone and, I can see that I can look at them and know that they have food allergies, or I can look and know that they have a fungal infection. I can see all these things. And at first I was like, oh, we really need to get your own medicine. We really need to do this. And that wasn't my job. It wasn't my time. It wasn't my place. I may know that, but they're also going through their life. They're going through their journey, and I have to respect that. And we all have to respect that in someone. And so that may be their life story is to live through it. But if someone asks, then it's okay to share.
One of my friends, the conversation right before this, Jill Renee Fuller, she's awesome. She came up with, what if we just made business cards of the name and then on the back, hey, we can talk, let's talk, and just go up to them and just hand them a business card. Hey, I think there's some things that we can help here. Here's a business card. And then that's it. Right. Like,
yeah, exactly.
Rather than trying to let me explain it right here. It's like, well, here's an offer. I'm like, oh, that's a really more gentle way.
That's cool.
Doing that.
I like it.
One of the things that you brought up, because I've seen this in guys too, and I have a huge heart for all the hard work that they do, is how guys, and especially my friends in the military, they're less likely to ask for help.
Mm-hmm.
How can we shift that? Or what have you seen? Like, how do guys make that shift for themselves to come into your office?
It's kind of interesting because more and more men have been coming in, I would say, in the last probably 2 years than I've seen in my career. And I think they're coming in because they're just tired of feeling the way they are. But there are a lot of men, I've been told this, and men are more geared to YouTube than other social media aspects, and there's a lot of men coming onto YouTube and they're doing a lot of talking. And so I think they're getting a lot more vocal, and with the new documentaries that are coming out, that seems to be the marketing aspect for men. And it's, I think, creating a shift more so than a partner or a friend like beating it into them that they need to go see the doctor. I think it's them actually watching these things that are, and that tends to be what they're telling me too. I saw this on YouTube. I don't know if it works, but I want to try it. So it seems to be the big shift. So I think the more information, they're just, men don't usually talk like women talk, it's not the same. So I think them having a source now, to have a little bit of that shared is might be a game changer for them.
That's really cool. I had not heard that yet. That's really hopeful and awesome. Yeah. What are some things that we could do right now to improve our environment? Like, is there a top 5, or are there things that we can improve environments?
Environment inside your house or work environment?
Whatever. I mean, what can make the most amount of difference in our lives if we just paid attention to these things?
Okay.
So off the top of my head is like, I was just reading an article about the plastics in water bottles, right?
Yeah. So doing a good quality filtered water system in your house, or buying good quality drinking water, is really important. Drinking from glass or stainless steel is really important. Trying to avoid plastic as much as possible with all sources. Never eating anything that's ever been heated in plastic, or that plastic has, even warmed up. So your
Why is
plastic,
that important?
Because plastic will leach into the foods when it heats up. Even if it says BPA free or microwave safe, it will leach in. And some of these chemicals are xenoestrogens, and they create an estrogenic effect within the body. There's other chemicals that leach in. A lot of these tend to be lipophilic, so they like fat, and they'll go in and store in the fat a little bit longer. So for toxic purposes, it's best to always be eating out of glass, or drinking out of glass and stainless steel, and drinking filtered water. So that's really important. Something else that's really important is making sure that we are eating as organic as we can. Or if we can't afford organic foods, that we're looking at the Dirty Dozen list and the Clean 15 list, which are sponsored by the Environmental Working Group each year. They change every year.
Okay.
What else about that? GMOs, making sure we're avoiding GMO foods as much as possible. It's really hard to avoid them if we're eating out, but when we're making foods and bringing them in, which we should be trying to cook as much food as we can versus going out and eating, because foods at restaurants are typically lower on the list of organics and such.
Why is non-GMO important?
So GMOs are genetically modified foods. They have the highest pesticide, herbicide exposure. Some of them are Roundup ready, so they have to be sprayed with chemicals to even grow. There's lots of research in it, changing hormones within the body. There's a lot of studies coming out. There's numerous studies that are already out there. So just in general, I try to avoid that as much as possible, because I want to avoid, obviously, the herbicides, pesticides, and anything that could alter my cells and my body. Another thing is indoor air quality is probably one of the biggest problems we have to date. Our air gets stagnant in our house, and there's lots of health concerns that have been linked to indoor air pollution. So making sure that we're staying on top of dusting with microfiber cloths. And I hate to dust, but that's probably the top thing that we should do, and making sure we have a HEPA vacuum, and we're vacuuming all surfaces of our house, and we're not using like brooms, we're actually vacuuming.
Okay.
That will keep things down. Having a good quality air filter is important, but it's not the number one. It depends on the person's health problems and what all is going on with their system, but definitely indoor air pollution is a problem. And then personal care products. That is the one thing the average woman puts on over 14 products before they walk out of the bathroom in the morning to go to work or whatever. Those are loaded with chemicals, from parabens and phthalates to all kinds of fragrances. And fragrances is a word that should be avoided at all costs because it has lots of chemicals in it. It's proprietary. So if we can go to more natural as much as possible and get away from that, that will eliminate hundreds, if not thousands, of chemicals every single day.
Wow.
And then there's a whole other source of stuff, but you know,
Right.
the bedroom should be the number one priority of the house, on keeping it clean and safe.
Because we spend 8 hours, well, hopefully,
Mm-hmm.
8 hours
Hopefully.
sleeping there. Um, well, this has been really amazing. What is there anything you wish we covered that we talked about, or?
You know, I think we covered a lot of ground, but I think my biggest thing right now is just making sure everyone is, you know, waking up and paying attention to what's going on. And again, you know, checking other places versus our mainline media. And on social media, if you see something and you agree with it and it's on some naturopathic, functional medicine, on some kind of group, share it, because they're getting blocked. And so the only way anyone else is going to see it is if you share it. If you like it, it's not going to count. You have to actually share it for people to see it.
And different words get hijacked, like waking up, right?
Mm-hmm.
Like I see it used on full
Yeah. Yeah.
But it sounds like your definition is educate yourself, ask questions.
Educate yourself, ask questions, know what's going on. There's a lot of things that go on behind the scenes every single day that you're not aware of. There's, you know, medications, there's supplements, there's things that get pulled all the time that you might not need right now, but you might need in 10 years. And now we don't have access because they pulled it, and they didn't pull it for a good reason. You know, the pressures for everyone to have a vaccine, or the pressures for this or that. You know, you may agree with it, you might not agree with it, but you have to do your own research and know what's in those things. You know, don't take the word that everything is safe for every single person. Like, look and see. And again, you know, yes, hashtags are notorious for getting pulled. They're notorious for those things, but really sharing the message. If you're in a group with people of like-minded people and you start talking, tell stories about, you know, your friend that is you know, whatever, that does energy work here or there. Like, tell those things, because energy workers might not be getting blocked as much, but it's really hard for anyone to see you in these times right now because there's major censorship.
So cool. Thank you. So I love asking this one question at the end of every single of my podcasts. What surprises and delights you about yourself?
My tenacity surprises me. I'm very
How does it surprise you?
Because my motto is kick ass and take names. Like, I just keep going. And it's like, no matter how many times I get kicked down, I still keep getting back up and going out there to be someone's voice.
That's awesome. Well, thank you so much for saying yes to be on the show. I've already got a list of like 4 or 5 places that I'm like, okay, Julie needs to come to talk to this group and this group. So I hope they all say yes, and as well as you, because I think education is a huge part of it, right? And you and Emily and even Connie are great educators as far as I've come into contact with. How can we get a hold of you? How do we find you?
So I have my website, which is rivercreekwellness.com, and I have, I think, a contact link on there. Our phone number's on there, which is 509-919-1385. Right now, we do have a local office in Spokane Valley. We're looking at probably shifting to more telemedicine, telehealth, and we look forward to visiting cities and probably branching out to other places in the near future.
Is that available yet on how to get a hold of you at telehealth, or just Riverside
Yeah, so
Wellness?
we have a scheduling link on there that is for telehealth services for people across the country, that they can get a hold of us through that link, as well as we're probably going to be doing more educating and putting that out there in the next couple of months. Before, it wasn't something that we were really pressing. I have seen patients all over the country and the world, but we were just kind of not doing it. But now with the whole COVID, people are getting more and more used to it. So we're just going to write it out.
Well, and
And
I think it's a great, I think it's a great way, because you have the ability to access more people than just your local
Mhm.
area that may not be aware yet,
Exactly.
aware of the
Exactly.
opportunities.
Exactly. So yeah.
Well, this has been amazing. Thank you so much
Awesome.
for being here.
Thank you for having me. It's been fun.
Have a great day, everybody.
Thank